In today's Wellness Wednesday, breast health entails more than just getting a mammogram. Joining us now from the Cancer Institute of St. Joseph Medical Center, our breast surgeon and medical director, Dr. Suliat Nurudeen, and we have breast surgeon Dr. Ethan Rogers. Dr. Nurudeen, I want to start with you. It seems like patients need to understand that the term breast health is different for every single person.
That's very true. Breast health is different for every individual patient. Breast health really entails making sure that you understand your individual screening plan. That includes engaging with your primary care provider to determine what the screening protocol should be for you. There are varying guidelines about when you should start your mammogram, whether or not you should do self-breast examinations. I think what's most important is making sure that you engage with your provider so you know exactly what your risk may be and what your program should entail.
And Dr. Rogers, can you explain why understanding one's individual risk factors is the key to good breast health?
Well, in the United States, a woman has about a 12.5% lifetime risk for developing breast cancer, but that's the average risk. So there are women who have a much higher risk for developing breast cancer based on their own personal medical history, prior biopsies that demonstrated a precancerous lesion, and family history. So it's important to know what the risk is to know what appropriate screening is. And so we have an online risk assessment tool at our website that helps us figure out what the risks are for women to develop breast cancer in their lifetime. And sometimes we tailor screening to meet that risk. So while most women just get a mammogram per year, some will need an MRI per year as well.
And while not all forms of breast disease are cancer, of course, we need to be mindful of all forms of breast disease. Can you explain and expand upon that just a little bit more for us?
That's very true. All forms of breast disease do matter. A lot of times when we think about breast disease, our mind automatically goes to breast cancer. But there are other breast conditions that we see and evaluate here in our breast health center. There are concerns such as nipple discharge, breast masses that more than often are not related to a breast cancer diagnosis. But it is important to have evaluation of these conditions because if there is something that may increase your risk of a future breast cancer, it's important that you have a screening program that's tailored to your needs.
It's always worth repeating that breast cancer does not affect only women.
That's true. Men also develop breast cancer. About 1 in 833 men will develop breast cancer, which is about 2,500 per year in the United States. And so the risk isn't the same as women. It's important for men to be aware of what's going on with their breast health and also be aware of their family history to figure out whether or not they might be at risk for developing breast cancer.
And we talk about breast health in October, but it really is a year-round, lifelong concern, isn't it?
Yes, we can't just focus on breast cancer care in October. While it may be the impetus for you to engage with your provider regarding your breast health, we really have to be knowledgeable about breast disease throughout the year. It's important that if you do have new concerns, that you do reach out for an evaluation.
Dr. Nurudeen and Dr. Rogers, thank you so much for being with us. And as a reminder, you can learn more with our Breast Health Center providers during our Pink Table Talk Facebook Live hosted by WMAR2 News on October 28th at 1 p.m. And to learn more about the Breast Health Center and to schedule your mammogram at St. Joseph, visit umstjoseph.org/breasthealth. We'll be right back with more Midday Maryland right after this. Stay tuned.